Sickness. How can we handle it effectively? What can you as a sick person do in a time of significant illness? Ask God for guidance. The fact that Christians do not know when, how, and where to use their blessings correctly or effectively is probably most obvious in the area of healthcare. Pray that God will show you what you need to take in, apply to, or do with your body. This is critical, because health practitioners' prescriptions often do not consider every single aspect, nor in the exact detail required. The focus of these prescriptions is usually on the most important or common items that the body requires or needs to avoid. This means that many in-between things are often missed, leaving them subject to the sick person's own discretion. Even if you are suffering from the same condition as your neighbor and you are on the same course of treatment, your body might still respond differently to what enters or is applied to it. There are many things that apply to most people, but not to all people, especially given their different body types and the unique body makeup of a person. The amount of information provided by healthcare practitioners and institutions is not always sufficient to enable patients to make the correct decisions regarding their health and healthcare procedures. Even the information contained in their information pamphlets or electronic media is not specific enough. The small information pamphlets in the medication packets tell you about the contraindications, i.e., that certain existing illnesses or symptoms will worsen when taking a particular medication, but they do not tell you that if you suffer from certain illnesses, the medication will not be effective. People are not informed that the use of certain things that could improve their state of health will only be effective in the presence of certain factors and in the absence of others. Healthcare is still fragmented and requires more integration. Research on how artificial intelligence and other computer applications could be used to improve this and ensure more customized medical intervention for patients is therefore constantly being done. Some medical guidelines only focus on or address single impairments, but not more of the same or more problems, such as the presence of more than one disease in a particular patient. You can, however, be bold in asking God for wisdom, insight, and comprehension regarding all these aspects, even though some people view them as being too insignificant to pray about. The reality for many people is that, had they consulted God for guidance and followed His leading concerning the things and people they were exposed to, they would not have contracted these illnesses or sustained these injuries in the first place. These include their eating habits, sleeping patterns, job duties, home responsibilities, hobbies, travel plans, sporting activities, exercise routines, and school and college tasks. The following are examples of specific things you may ask God to show you, given your uncertainty and the sickness you are suffering from. Ask God what to obtain, use, or practice, whether oranges or lemons, waterproof plasters or fabric dressings, a walker or a wheelchair, aerobic or strengthening exercises. Ask Him how many of the items you need to obtain, use, or do, whether 5 or 8 oranges, a pack of 10 or 15 fabric dressings, or 10 or 20 exercise repetitions. Ask God to show you how you should consume, use, or apply it. Whether you should simply eat the orange as it is, blend it and drink it as a smoothie, or juice it completely without any pulp residue and drink the whole orange as a thin liquid. Allow Him to guide you as to what you need to or should not use or consume with it, before or after it, to increase the potency of its benefits or prevent the minimization of its medicinal properties. Whether it be water, other fruit, certain foodstuffs, or other medicinal substances. Ask God how often you should consume or do it. Should you eat oranges 2 or 4 times a day? Must you only perform exercises 3 days a week, or every morning of the week? Ask God for guidance about when you should consume, apply, or do it. Morning only, in the afternoon, or at night as well. Ask Him how much you should consume, 1 or 2 glasses of orange juice per day. Ask for guidance regarding when you should use it. Only use the walker when going outside the house, or inside as well. Should you do your exercises on the lawn, or should you rather do them in the swimming pool? Ask Him which steps you must follow, whether you should first apply antiseptic ointment to the wound, or only use gauze with antiseptic liquid, before putting on the bandage, or not. Trust and believe in God for healing. Who or what do you trust and rely on? This is a critical question you need to answer for yourself, not only in times of sickness, but throughout the course of your life. As the Christian life is essentially a life of faith, you are not guided by the temporal things you see. 2 Corinthians 5 verse 7. Do you believe that your disease can give way to healing? Do you want your sickness to make room for good health? Have faith that God will do for you what you desire Him to do, namely to heal you according to His will. Many people do not receive it, simply because they do not believe it. As a child of God, you should not put your overall trust in medical treatment, staff, equipment, assistive devices, or even your general state of health. These things all contribute to recovery from sickness. Your trust should still be in the Lord for healing, because if He does not heal you, you will not recover, despite receiving the best possible medical care. Just as with other things, the best treatment money can buy is not necessarily the best in existence or available. Some Christians only tend to trust the Lord when medical science or alternative medicine is unable to do anything further for the curing of their disease. In other words, they only have faith in Him to heal what man cannot treat. As with other aspects of the Christian life, trust in the Lord should not only start after man's efforts proved unsuccessful. On the contrary, it is supposed to be the guiding principle right from the beginning. You should not run to God only when you have run out of options and no help seems to be in sight. Do not be like King Asa, who disregarded the fact that God could touch his body and cure him, as if God had no power to do so. 2 Chronicles 16 verse 12 thus describes it, "And Asa in the 39th year of his reign was diseased in his feet, until his disease was exceeding great. Yet in his disease he sought not to the Lord, but to the physicians. In order for God's healing to be your portion, it is He who must direct it toward you as His child. He is the source of all healing power. Furthermore, you need to understand that you are not only made of flesh and bone, i.e., you do not only have a physical component to your being. Your daily functioning and state of health may thus appear completely different from what medical imaging, X-rays and other scans, and blood tests say, whether more positive or negative. It is important to note that the ultimate outcome of healthcare is the preservation of life. The clinical intervention of doctors, paramedics, nurses, and other health professionals helps prevent people from dying at a certain point in time. Unfortunately, a person cannot be saved from dying eventually, unless he is alive at the time of the second coming of Christ. Since your health is clearly in the hand of God and not man, you must never fail to trust Him for good health.